Why does one testicle hang lower than the other? Have you ever looked down and noticed that one of your testicles hangs lower than the other? And maybe you immediately wondered, is that normal? Or even, is there something wrong with one of my testicles? Here's the good news. For most men, having one testicle hang slightly lower than the other is completely normal. In fact, perfect symmetry would probably be more unusual. But there are situations where a difference between your testicles is not something you should simply ignore, especially if that difference appeared suddenly or is associated with pain, swelling, or a lump. I'm a practicing urologist, and in this video, I'll explain why one testicle usually hangs lower, what's considered normal, and which changes should make you see a doctor. First, is it normal for one testicle to hang lower? Yes. For the vast majority of men, the testicles are not positioned at exactly the same height. Usually, one hangs slightly lower than the other. Very often, that's the left testicle, although it doesn't have to be. And there's actually a practical reason for this asymmetry. If both testicles were hanging at exactly the same level, they would have less room and could press against each other more easily when you walk, run, or sit down. Having them at slightly different heights allows them to sit next to each other more comfortably. So if you've had this difference for as long as you can remember and you have no pain, swelling, or other symptoms, it's usually just normal anatomy. This is something men sometimes become worried about only because they've suddenly started paying attention to it. They tell me, "Doctor, I've just noticed that my left testicle hangs lower, and one of my first questions is, has it actually changed? Or have you simply noticed it for the first time?" That's an important distinction. A difference that's probably been there for years is very different from a testicle that has suddenly changed position, size, or appearance. Why do the testicles move anyway? Your testicles aren't simply hanging completely still inside the scrotum. There are muscles that can move them closer to or farther away from your body. One of them is called the cremaster muscle. Temperature plays an important role here. When you're cold, the testicles are pulled closer toward the body. When you're warm, the scrotum relaxes and the testicles tend to hang lower. That's one reason your scrotum can look completely different after a cold shower compared with after sitting in a warm bath. Exercise, touch, stress, and sexual activity can also affect the position of the testicles. So the position of your testicles can change throughout the day. That's normal. Why is the left testicle often lower? There are small anatomical differences between the two sides of the body. The blood vessels and spermatic cords are not completely identical on the left and right. The left testicular vein, for example, drains differently from the right side. This is also one reason certain conditions, such as a varicocele, occur more commonly on the left. But simply having the left testicle slightly lower than the right does not mean you have a varicocele or another disease. For many men, that's simply their normal anatomy. What interests me much more than whether one testicle is 1 or 2 centimeters lower is whether something has changed. If you tell me, it's always looked like this, and the testicles otherwise feel normal, that's usually reassuring. But if you tell me, for the last 3 weeks, one side suddenly looks much larger and hangs differently, then I want to know why. In urology, change over time is often much more informative than perfect symmetry. When can a lower hanging testicle be a problem? There are several conditions that can change the appearance of the scrotum. One is a varicocele. A varicocele is an enlargement of the veins around the testicle. It's much more common on the left side. Some men don't notice anything at all. Others describe heaviness, a dull ache, or veins that feel almost like a bag of worms. The discomfort may become more noticeable after standing for a long time or after exercise. Varicoceles are usually not emergencies, but they can sometimes cause discomfort and may be associated with fertility problems or changes in testicular size. What about a hydrocele? Another possibility is a hydrocele. That's a collection of fluid around the testicle. It can make one side of the scrotum look significantly larger than the other. Often it isn't painful. Some men simply notice one side has gradually become much bigger. That's different from simply having one normal testicle hanging slightly lower. A persistent new swelling should be examined. And what about testicular cancer? This is something many men worry about. Testicular cancer usually doesn't present simply as, "My left testicle hangs a little lower." What concerns us more is a new hard lump, enlargement of the testicle, or a persistent change in its consistency. And importantly, testicular cancer is often painless. So don't assume everything is fine just because something doesn't hurt. One thing I regularly tell men is, you don't need to compare your testicles every morning with a ruler, but you should have a general idea of what is normal for you. That way, you're much more likely to notice a genuine change. If one testicle has always been slightly lower, that's usually normal. If one suddenly becomes larger, harder, swollen, or develops a new lump, that's something completely different. What if one testicle suddenly sits higher? Now, this is particularly important. We've been talking about a testicle hanging lower. But a testicle that suddenly appears higher than usual, especially together with severe pain, can be a warning sign of testicular torsion. In torsion, the spermatic cord twists and can cut off the blood supply to the testicle. The pain is usually sudden and severe, and nausea or vomiting may occur. This is a medical emergency. If you suddenly develop severe pain in one testicle and it appears unusually high or positioned differently, don't wait until tomorrow to see if it gets better. Seek urgent medical attention. This is the distinction I want you to remember. A testicle that has always hung slightly lower is usually normal. A testicle that suddenly changes position, particularly with severe pain, is not something to ignore. With testicular torsion, time matters. So sudden severe pain is a completely different situation from the normal asymmetry we're discussing in this video. Are different testicle sizes normal too? A small difference in size can also be normal. Human bodies aren't perfectly symmetrical, but a major difference in size, especially if it's new, deserves evaluation. One testicle becoming smaller can occasionally indicate previous injury, impaired blood supply, infection, or other problems. One side becoming larger may be caused by fluid, enlarged veins, inflammation, or a mass. If you're unsure, a physical examination and ultrasound can usually clarify what's going on. Should you examine your testicles? You don't need to obsessively check them, but it's useful to know what your normal anatomy feels like. The testicle itself should generally feel smooth and firm, but not rock hard. Behind it, you'll feel the epididymis, which is a normal structure and can sometimes be mistaken for a lump. If you discover a new hard lump within the testicle itself, persistent enlargement, or another new change, get it checked. So, when should you worry? If one testicle has always hung slightly lower than the other, and there are no other symptoms, that's usually completely normal. But see a doctor if you notice a new lump, significant swelling, a major change in size, persistent discomfort, or a new change in the position of one testicle. And if you develop sudden severe testicular pain, especially with nausea, vomiting, swelling, or a testicle that suddenly sits unusually high, seek urgent medical attention. Conclusion. So, why does one testicle hang lower than the other? In most cases, because that's simply how the male body is built. Your testicles don't need to be perfectly symmetrical. One hanging slightly lower, commonly the left, is usually completely normal. The thing that matters much more is change. If your testicles have always looked this way, there's usually no reason to worry. But if something suddenly becomes larger, harder, painful, swollen, or changes position, get it evaluated. And remember, sudden severe testicular pain is never something you should simply wait out. If you found this video helpful, please like the video and subscribe to the channel for more straightforward urology information from a practicing urologist. Thanks for watching, and I'll see you in the next video.